Hello, everyone. Today, we're delving into the intricacies of our medical benefits coverage. Let's break down what qualifies as eligible expenses according to our policy.
Yeah, I think it's crucial for us to understand what's covered under our policy, especially when it comes to eligible medical expenses.
Absolutely. Can you give me a quick overview?
Sure thing. So, our insurer will reimburse us for certain medical costs related to new illnesses or injuries covered under the policy. These expenses must meet specific criteria outlined in the policy.
Got it. What kinds of expenses are included?
Well, charges incurred at hospitals for things like room and board, nursing services, and ancillary services are covered. It even includes emergency treatments for new injuries or illnesses, regardless of hospitalization. However, there is a $250 deductible for each emergency room visit for illnesses that do not result in direct hospital admission.
That's reassuring. What about surgeries or outpatient procedures?
Surgeries at outpatient facilities are covered, as well as professional services provided by physicians, including necessary supplies like dressings and sutures.
Okay, that sounds comprehensive. But what if we need specialized treatments like chemotherapy or radiation therapy?
For a new illness, those are covered too, along with things like durable medical equipment, home nursing care, and even ambulance transport in certain situations.
Wow, that's more extensive than I expected. But what about pre-certification requirements?
Right, certain treatments or procedures need to be pre-certified to ensure they're medically necessary. If we don't comply, it could affect our benefits.
I see. And what happens in an emergency situation?
In the event of an emergency hospital admission, pre-certification must be completed within 48 hours after admission, or as soon as possible.
Got it. And what if we disagree with a claims decision?
We have the option to appeal the decision by providing additional documentation to support our case. The company will reconsider its decision based on that.
Okay, that's good to know. Thanks for going through this with me, Jason. I feel a lot more informed now.
No problem, Lisa. It's important for both of us to understand our coverage, especially when it comes to our health. I think we need to understand the pre-certification requirements. It's important for us to know how they affect our coverage.
All right, let's dive into it. What do we need to know about pre-certification?
Pre-certification is basically a determination of medical necessity made by the insurance company before certain treatments or procedures.
Got it. So, how does that process work exactly?
Well, the insurance company relies on the information provided by us, our relatives, guardians, or healthcare providers to assess the medical necessity of the treatment.
And what if they find that the treatment isn't medically necessary?
If they dispute the necessity based on subsequent information, they have the right to challenge or revoke the pre-certification.
I see. So, just because something is pre-certified doesn't mean it's guaranteed to be covered.
Exactly. Pre-certification doesn't assure coverage or guarantee payment. It's more of a preliminary assessment.
That's good to know. Are there specific treatments that always require pre-certification?
Yes, treatments like chemotherapy, extended care facility stays, and surgeries always require pre-certification. If you are hospitalized, it needs pre-certification too.
And how do we ensure compliance with these requirements?
We need to contact the company through the plan administrator as soon as possible before getting the treatment. We also have to submit all necessary information and documents and make sure our healthcare providers are aware of the pre-certification requirements.
Communication is key.
Absolutely. And if we or our healthcare providers fail to comply, it could result in a loss of coverage or benefits. So, the policy says that if you experience an acute onset of a non-chronic pre-existing condition during our trip using an in-network provider, we should be covered for eligible medical expenses.
That's reassuring. But are there any conditions or restrictions we need to be aware of?
Yes, there are several conditions we need to meet to qualify for coverage. For example, treatment must be obtained within 24 hours of the sudden outbreak or reoccurrence.
And I see here that the insured person must be under 70 years of age and not traveling against medical advice.
Right. We also can't be traveling with the intent to seek treatment for the pre-existing condition or undergoing any new treatment programs.
and the pre-existing condition must have been stable for at least 30 days before our trip.
Plus, we must be traveling outside our country of residence to qualify for coverage.
It's a lot to keep in mind, but it's important to understand these conditions before we travel.
Definitely. We need to make sure we're in compliance with all the terms of the insurance to be eligible for coverage.
Thanks for bringing this up, Jason. It's better to be informed before we hit the road.
No problem, Lisa. It's always good to review our insurance coverage, especially when we're traveling.
Thank you, Jason. In our next video, we will discuss additional details about our coverage.